Hey, thanks for making it to Veterans Info Tap. I'm glad you made it today. Today I wanted to talk to you about a watchdog group that is targeting or looking at the VA and making sure that they're doing their part. This watchdog group is called the Government Accountability Office, and I wanted to read to you what they had to say about the VA and some of the displeasures that they had to bring up. The title or the headline here is VA Still Challenged to Provide Veterans Timely Health Care, Watchdog Says. So that's the headline. Hit the thumbs up for me, subscribe, share with a friend, all that good stuff, because it's these types of things that are going on and being brought up or viewed by us and looked at by these watchdog groups that then we can leverage that knowledge and share it with our congressional members who may not be in the know sometimes. I will tell you, on the D.C. side of the House, your congressional representative may have veterans as far as talking points are concerned, and they'll lean forward and do what's right, but oftentimes they're not aware of every single thing. So the more that we can inform their office, the better they can provide the legislative efforts that may be needed for us. So anyway, let's jump into it. It's fairly short here. Let's jump in. After more than a decade, veterans' access to timely health care is still the number one challenge for the Department of Veterans Affairs, according to a government watchdog. The Government Accountability Office unveiled the finding as part of its annual high-risk list of recommendations for the federal government. So as a whole, right, federal government as a whole, but they honed in on Veterans Affairs. This was released in May. The agency says it first raised concerns in 2012. That's a long time ago. 10 years ago, 11 years ago, about the VA's difficulties in overseeing veteran health care, including primary care. How is it that the VA has not knocked timely health care from the top of its list of concerns? Good point. So let me reread that since I kind of butchered it. How is it that the VA has not knocked timely health care from the top of its list of concerns, according to the GAO, by not fixing the problem that the watchdog agency identified 10 years ago? The GAO's report made public May 30th shows that while the VA has made progress, many old issues are still unresolved. And we all know it, right? Any of us that have been involved with the VA for any period of time get it. Moving on, the two main problems besetting the agency both have to do with how the VA defines acceptable wait times and how it tracks appointments according to the GAO. First, it should be easier for veterans to pick a date that's convenient for them to be seen quickly. But existing VA policy is not helping. The report states that clarifying scheduling policy to better define the desired date is one of the ways to help veterans. A second issue is that the VA's own definition and policies regarding wait times are vague. Welcome to nuance, right? This makes it difficult for leaders to make consistent measurements. The flexibility standards for success or failure lead to mistakes in scheduling appointments. Per the GAO's report, the solution is to identify clearer wait time measures that are not subject to interpretation and phone to scheduler error. When the GAO's healthcare section recommended that the VA address wait times for veterans in 2012, mind you, the original report identified a similar set of challenges resulting in unusually long wait times for appointments. Back then, it offered two solutions. It was suggested that the VA improve its online tools for coordinated appointments and prescriptions. First launched in 2003, My Healthy Vet went through several upgrades after the GAO made its recommendations. According to the VA officials, the department is in the process of implementing a new scheduling system that officials believe is a key part of addressing our recommendation, the GAO report reads. The system has a targeted national completion date of 2027, so what's that, 4 more years. A more controversial solution to the problem of wait times involved the VA outsourcing some patient care to private doctors. As reported by military.com in January, the initiative has had mixed results. About 90% of VA medical centers and or VAMCs reported scheduling at least half of their veterans appointments with healthcare specialists within the 3-day period required under the VA policy, suggesting that the initiative was a success. But fewer than 40% were able to do the same for a broader community-based care, where the standard is 7 days. Some veterans waited longer for community care, a month or more, than they would have had waited for care within the VAMC. That suggested the private healthcare solution favored by some won't actually alleviate veteran wait times and could make them actually be worse, which would be horrific. The VA's struggles with wait times go back years and hit in 2014. That year, its problems came into sharp focus when it was reported that 40 veterans had died. We all remember that time frame when there was a lot of talk about the VA is just pushing things out and waiting for vets to die. So 40 veterans had died, waiting for medical care. Subsequent investigations turned up many of the same concerns the GAO had voiced in 2013, spurred in-depth reporting by national outlets, including the New York Times, and showed that more than 125,000 veterans had waited too long for appointments. The scandal revealed that some VA employees had conspired to cover up data that made the department look bad. The scandals shook the agency and led to the resignation of the VA secretary at the time, who had earlier served as Army Chief of Staff, although older veterans had memories of how during the Vietnam War era and earlier, VA medical centers were viewed with skepticism or even hostility. That reputation had, for the most part, been rehabilitated with younger veterans. Those scandals set the VA's reputation back decades. VA leaders are hopeful that they will meet the goal of streamlining the agency's system to make wait times standard and measurable by 2027. In a statement delivered by email, it stressed their commitment of transparent data about wait times and a commitment to resolving the issue highlighted by veterans and by the GAO's reports. There's nothing more important to VA than providing veterans with world-class care that they deserve whenever they need it. And wherever they need it, said Terrence Hayes, the VA press secretary, via email. We are consistently working to minimize wait times for the veterans we serve, regardless of whether that care is delivered at VA hospitals, veterans' homes, including telehealth, or community hospitals. Hayes said that the agency is currently providing more care to more veterans than ever before in its history. It had 332 million veterans care appointments during the COVID-19 pandemic, he said. Hayes added that the Access to Care website gives transparent information about local wait times at various VAMCs, and criteria for calculating wait times are defined on the site. We are using veteran feedback to continue improving how we measure and publicly report this information, he said. And then that concludes this article here. So strewn with past scandals, cover-ups, the Watchdog calling out the VA on the wait times. And many of us are well aware of the wait times. And I will tell you that if you're not aware, if you're 100% rated, you are front loaded for appointments. If you're a 20, 30, 40, 50% rated, you're not, well, especially if you're a 20 or 30% rated veteran who's utilizing the VA for healthcare, it's going to be, you're pushed back a little bit. So what might be fast for some of us, location wise, I've had no problems. I get in right away. It's very easy. You may be a higher rated veteran who's able to get front loaded. Other person who has a 20% rating or 30% rating won't get that same experience. So just food for thought. All right, with that, we'll go ahead and conclude it. Thank you so much for watching. I really appreciate you. Have a great one. And remember, if we don't take care of each other, something went wrong.